What is Lotrel, Amlodipine/Benazepril? Lotrel is a prescription medication that combines two widely recommended drugs, Amlodipine and Benazepril, to effectively manage high blood pressure, hypertension. This combination therapy not only helps reduce blood pressure levels but also lowers the risk of serious cardiovascular events, including heart attack, stroke, and heart failure. Lotrel is available in a generic form under the name Amlodipine/Benazepril, making it a more affordable option for long-term hypertension treatment. It is typically taken orally once a day. How Amlodipine/Benazepril works. Lotrel, Amlodipine/Benazepril, functions through the complementary actions of two drug classes. Amlodipine, a calcium channel blocker, CCB, relaxes the smooth muscles in the blood vessel walls, promoting easier blood flow and thereby lowering blood pressure. Benazepril, an angiotensin-converting enzyme AC inhibitor, prevents the production of a natural chemical that narrows blood vessels. By doing so, it further reduces vascular resistance and improves circulation. This dual mechanism is particularly effective in managing hypertension, especially in individuals who require more than one medication to reach their target blood pressure goals. What is Amlodipine/Benazepril used for? Treatment of high blood pressure, hypertension. By lowering blood pressure, Amlodipine/Benazepril reduces the workload on the heart and helps prevent complications such as stroke, heart failure, and kidney damage. Common side effects of generic Lotrel. While generally well tolerated, Amlodipine/Benazepril can cause side effects in some patients. Common side effects include cough, 3%, headache, 2%, swelling in the hands or feet, 2%, dizziness, 1%. Other possible side effects: skin rash, facial flushing, drowsiness or fatigue. Serious side effects: seek immediate medical attention. Although rare, some individuals may experience serious adverse reactions. Angioedema, severe swelling of the face, lips, tongue, throat, arms, or legs. Heart attack symptoms: chest pain, shortness of breath, sweating, dizziness, fatigue. Kidney complications: reduced urination, swelling in extremities, sudden weight gain. Hyperkalemia, high potassium, nausea, muscle weakness, irregular heartbeat. Hypotension, fainting, lightheadedness, pale or cold skin. Liver issues, abdominal swelling, yellowing of the skin or eyes, confusion, dark urine. Important considerations. For optimal results, individuals taking Amlodipine/Benazepril are advised to maintain a balanced diet, engage in regular physical activity, and follow their healthcare provider's instructions closely. Consistency with medication and lifestyle choices plays a critical role in achieving long-term blood pressure control. Lotrel, Amlodipine/Benazepril. Dosage forms and cost information. Lotrel, a prescription medication used to treat high blood pressure, is available in capsule form and contains a fixed combination of two active ingredients: amlodipine, a calcium channel blocker, and benazepril, an ACE inhibitor. Together, they work to lower blood pressure and reduce the risk of serious cardiovascular events such as stroke and heart attack. Available dosage forms. Lotrel, Amlodipine/Benazepril, is available in several fixed-dose strengths, allowing providers to tailor treatment to each patient's needs. 2.5 mg/10 mg, 5 mg/10 mg, 5 mg/20 mg, 10 mg/20 mg, 10 mg/40 mg. All forms are administered once daily by mouth, typically with or without food. Typical dosing guidelines. The usual starting dose for adults is 2.5 mg/10 mg once daily. Your healthcare provider may gradually increase your dose depending on how your body responds to treatment and whether side effects are present. The maximum recommended dose is 10 mg/40 mg once daily. Because this is a combination therapy, dosage adjustments are made cautiously to avoid lowering blood pressure too quickly or causing adverse reactions. Should I ask my healthcare provider about starting Lotrel, Amlodipine/Benazepril? If you've just been diagnosed with high blood pressure, your healthcare provider is unlikely to prescribe Lotrel, Amlodipine/Benazepril as the initial treatment. Because this medication combines two powerful blood pressure agents, starting it too early can result in an excessive drop in blood pressure, leading to side effects such as dizziness or lightheadedness. Typically, Amlodipine/Benazepril is prescribed for individuals who have already been taking one of the two components, or medications within the same drug classes, and may require a second agent to better control their blood pressure. In other cases, a provider may recommend generic Lotrel for convenience once blood pressure has been stabilized using Amlodipine and Benazepril separately. If you're newly diagnosed, your provider may prefer to initiate treatment with a single medication before transitioning to combination therapy. Always consult your provider to determine the most appropriate treatment plan for your specific condition. How do I know if Lotrel, Amlodipine/Benazepril, is working? You may not feel any different while taking Amlodipine/Benazepril, but that doesn't mean it isn't working. The best way to assess the effectiveness of your treatment is by monitoring your blood pressure regularly at home. Record your readings and share them with your provider at follow-up appointments. Even if you don't notice immediate physical changes, it's essential to stay consistent with your medication. Controlling blood pressure significantly reduces your risk of serious cardiovascular events, including stroke, heart failure, and heart attack. How long does it take for Amlodipine/Benazepril to start working? The full blood pressure lowering effect of Lotrel, Amlodipine/Benazepril, may take up to 2 weeks to become apparent. During this period, your provider may monitor your progress and make dosage adjustments based on your response and any side effects. It's important to remain patient and continue taking your medication as prescribed. Blood pressure management is a gradual process, and ongoing follow-up with your provider ensures the best outcome. Will Lotrel, Amlodipine/Benazepril, cause a cough? Yes, dry cough is a known side effect of ACE inhibitors, including Benazepril, one of the two active ingredients in Lotrel. This side effect can develop at any time during treatment and may become bothersome for some individuals. If you experience a persistent cough, contact your healthcare provider. They may recommend switching to a different class of blood pressure medication, such as an angiotensin II receptor blocker, ARB, which is less likely to cause this symptom. Can I take Lotrel, Amlodipine/Benazepril, during pregnancy? No, Lotrel, Amlodipine/Benazepril, should not be taken during pregnancy. ACE inhibitors like Benazepril can cause serious harm to an unborn baby, including impaired kidney development and other potentially life-threatening complications. If you are pregnant, planning to become pregnant, or suspect you might be pregnant, consult your healthcare provider immediately. They can recommend safer alternatives to control blood pressure during pregnancy. Need more reliable health insights? Subscribe to HeInfo for clear, evidence-based health explanations tailored for everyday people. Watch more videos on blood pressure treatments, medication safety, and heart health. Don't forget to like, comment, and subscribe to stay updated with new releases from HeInfo.